Exactly. Hey guys, back from life. So, last thing I remember, I was having a conversation. Next thing I know, I'm back here.
Doctor said it went great.
I guess I'm done.
Said you'll be out of here by 11 o'clock.
Wow, excellent. Okay.
Yeah, yeah. I'm sure he'll be in to talk to you as well.
Feels like I have a leg that's a ton of bricks, but above and beyond that, man, I'm on cloud 9 right now.
Yeah,
so.
I'm sure you're feeling no pain. You're in Disneyland.
Sorry. Thank you. No worries.
A video, huh? It's gonna be a YouTube. A YouTube thing, right?
Well, you know what I wanted to do is I wanted to experience the whole process from top to bottom, from the beginning all the way to my recovery, because you can look online and you can see a lot of people that talk about their basic experience, but don't really actually go through the whole process.
Yeah.
And you
So I
don't
thought
remember.
this-
So what do you? So what
yeah,
do you think?
exactly. And I thought this
Yeah.
would be a great way to go ahead and show everybody exactly.
So what do you think about the nose job? Looks pretty good, doesn't it?
Told him this will go viral.
Come on, don't
if they
take
work
away
on
that's
the wrong
the
leg.
Colombian trick. We can't take that away. So.
You nauseated,
Yep.
then you want to just slow down and go back to light foods like Jello or soup or
Okay.
toast or something mellow. If you've started off with those things and you're doing fine,
Mm-hmm.
then at that point you're okay to have something heavier,
Okay.
and you really just kind of let your stomach be your guide.
Okay.
Okay.
Fair enough.
The only time you have to have food is if you're going to have a pain pill.
Okay.
If you
Absolutely.
aren't, if you're not hungry at all, you don't need to force yourself
Sure,
to eat. But if
sure.
you're going to have a pain pill, you want to have something, crackers or
Okay.
a piece of bread or something. It doesn't have to be a meal,
Okay.
just something small.
Okay.
And the urination, if he has a problem with that,
Then call.
by like this evening.
Exactly.
If he feels like he needs to go,
So
he
if you
can't.
felt like there was a fever, you felt like you had problems urinating, you
Sure.
felt like you were really nauseated and your pills weren't helping you, or pain is just out of control,
Right.
if you felt like your toes were turning a funny color, or
Okay.
numbness or tingling, or anything just strange.
Okay.
If you had chest pain, if you
Okay.
couldn't take a deep breath,
Mhm.
any of those things,
Just out of the
just
norm
call
there.
us.
Okay.
Yeah,
Absolutely.
totally out of the normal.
Okay.
Really, none of those things are expected. What's expected is that you go home, you lay down, and you do exactly what you're doing now.
Okay.
You just kick the leg up on a couple pillows,
Yep.
and you just run the ice machine nonstop.
Okay.
Okay, so even through the night, that ice machine pad is wrapped into your dressing, and so that's going to stay on from now until you get your dressing off at your follow-up.
Okay.
So there's really no reason not to run it.
Okay.
It's just wrapped in there.
Fair enough.
And I'll teach you about the ice machine before you go.
Okay.
So 48 hours of pretty much just doing this.
Okay.
Just getting home, laying down, leg up on a couple pillows, ice running.
Okay.
Not getting up a lot.
Right.
I mean, you have to get up to do the necessary
Obviously.
things, but not just, you're going to be non-weight bearing, so you're going to be on your crutches.
Yes.
So it's not easy anyway.
I understand.
But as much as possible, just staying down. If
Okay.
you've got family members that can help you, can go grab a drink for you,
Sure.
can go grab a food for you, then
Of course.
let them.
Of course.
After those first 48 hours, then you can kind of start to increase.
Okay.
Kind of trial and error. That third day you're going to get up and
Absolutely.
be stir crazy and want to go do a few things
Yeah,
out
yeah,
on your
yeah,
crutches,
of
and you
course.
get home and your leg's going to be killing you, and all you can do is elevate it and ice it and
Okay.
know that was a little too much for the
Okay.
next day.
Okay. No.
Activity-wise, the physical therapist will go over what you can and can't do.
Okay.
So you'll have a few exercises like leg lifts, and they'll show you a couple quad exercises and
Okay.
ankle pumps. That's pretty much it for the first week.
Okay.
Once you're done with that first week, you're going to go in to see Dr. Cooley for your follow-up. So you
Right.
guys will call to make that appointment. Actually, yeah, I don't think you have it yet. You'll call and make that appointment,
Okay.
unless you already know that you have one.
All right.
Until that appointment, your dressing's got to stay dry.
Fair enough.
It's got to be clean and dry. So whatever you can come up with to keep it dry in the shower is fine with me.
Okay.
The easiest way is to get like a big lawn and leaf bag and cover up that leg
Sure,
and
sure,
just leave
absolutely.
it at the top, or tuck
Right.
it in, or whatever you need to do. That seems to be the easiest way.
Okay. Or just do towel baths or whatever.
Yeah, exactly. You can just do
Fair enough.
a bath and hang it out. You can have somebody help you with a bath and just do
Okay.
sort of like a sponge bath.
Okay.
People get really interesting and they put lawn chairs in their bathtub and a stool outside of it so they can hang their leg out.
Understand.
And, I mean, whatever you can come up with is
Okay,
fine.
fine.
Okay. But as long as you're doing your best to keep it dry.
Exactly.
Okay, you've got a lot of bandage to go through. It's not probably going to harm it if you get it a little wet, but it's going to get gross and dirty.
Understand.
The more you
Understand.
get wet,
Right.
okay?
Right.
So like I said, always keep an eye on your foot. You've got the nerve block that's working through your knee.
Yes.
The back of the leg usually feels pain
Correct.
because of the hamstring.
Right.
So you're probably going to have a little hamstring pain today,
Okay.
even though the nerve block's working.
Okay.
You shouldn't have any effects from the nerve block from that knee down. So if you started to feel like numbness and tingling in the toes, that would be from something else. So we would want you to call for that.
Okay.
So your toes should always be able to wiggle
Sure,
and
sure,
move, no problem.
Sure.
While your nerve block's working, definitely you're not relying on that leg at all. It's pretty mandatory from Dr. Cooley that you are not putting weight on the leg anyway. You're going to leave it up, but
Correct.
some people want to set it down for balance. And that's not really going to be an option while your nerve block's working.
No, I pretty much have everything all positioned at home. I got
Good.
the chair to lean back
Perfect.
and keep it up.
Perfect.
Yeah.
So no relying on that leg while you got the nerve block. It's probably going to wear off in the middle of the night sometime.
Right.
Tonight it's a 12 to 24 hour thing. So
Correct.
it could be the 12 hours where it's going to be before you go to bed.
Okay.
Or it could be 24 hours where it's after you wake up, it's still numb.
Mm-hmm.
Best case scenario. But either way, we want you to just start tonight, maybe around 10 or whatever time you're going to bed.
Mhm.
Take 2 of your Percocets.
Okay.
Okay? And then set your alarm every 4 hours, take 2 more.
Okay.
So that no matter what time it wears off in the middle of the night, you're covered. And
Okay.
it's not, it's a pretty easy transition. Otherwise, it can kind of be 0 to 60 because all that
Okay.
medicine that we've given you is going to be out of your system.
Understand.
May I interject 1 second?
Sure.
Ed, tell her you were thinking about trying to do this drugless, but the other nurse said maybe not such a great idea.
Yeah. So basically, there's this natural product. It's called drug and bone reconstruction or whatnot,
Uh-huh.
and it's Dr. Christopher's. And basically, what I wanted to do is they were actually even going to offer it to me even before the surgery to see if I even would need the surgery.
Yeah.
Apparently, it's designed to start a reconstruction.
Okay.
And whereas people have taken it, and it actually has taken all pain away.
Oh,
now,
really?
again, whether I'm still.
That is the claim on the internet.
Yeah, it's one of those things. It's one of those products. It's actually right here in Utah, and it's one of those things where I actually could be a test candidate for it because this is a perfect example
Right.
to see how well it can help me reduce.
Right.
But people said, I've heard of crushed foots, I've heard of different things that they've currently posted, and it actually has repaired them all
Really?
without surgery, without
Do you
everything
know what
at all.
kind of medication it is?
Yes, it's got 40 different products inside it. Everything is natural thing. I know a lot of roots and a lot of different products.
But not, is it any chance that there's an NSAID in it, like ibuprofen, Motrin, that kind
No.
of thing?
Nothing
Okay.
like that at all. It's
It's not a
all
blood
100%
thinning.
natural. No, it's all 100% natural. One product I know for sure because, of course, is the controversial wormwood.
Mm-hmm.
Yeah. And apparently, with all the other different active ingredients and stuff like that. But again, they said that the amount, again, not a doctor recommended,
Yeah,
not anybody recommended,
right.
but it's more of a naturalist.
Try it.
Yeah, that's exactly right. And so that's the way I'm going to try to see how it goes. And if it doesn't, it doesn't. But I'm going to try to do it without medication. I know
Good.
that sounds pretty
No,
odd.
try
but
it.
there
If
are
it
a lot
works.
of people that
I mean,
actually I have said
If
that
it works,
they don't
I want
need
to
it.
know.
Yeah.
Now, one
Yeah.
nurse warned him about letting the pain go too long and getting behind the curve because it's
Yeah, I mean,
you might
it
end
might
up
happen.
back at emergency
Right.
room.
It might happen.
Exactly.
It kind of depends on, I feel like people's pain depend on their expectation of the pain.
Yes.
If they think it's going to be painless, then a 3 out of 10 pain kills them.
Oh.
If
Right.
they think it's going to be a pretty painful procedure, then you're probably better,
Right.
you know.
And
better
I've
off.
experienced a lot of pain before, so I think I'm pretty comfortable as far as once it really gets to a particular point that I'm like, okay, I'm at my level, let me go ahead and start to do something about it.
Okay.
So, yeah.
Patient 17, can she put oil in there? No. No. Should I use quench?